Hi friends, this is Dr. Rajeshwari Reddy. I am a senior gynecologist from Hyderabad. Today I am going to answer the frequently asked questions on unprotected sex. What is unprotected sex? Any act of sexual activity which does not involve any kind of contraception is called unprotected sex. Sometimes you do use a condom which either broke or slipped or leaked during the sexual activity. That is also called as unprotected sex. And if you have not used any kind of contraception, as in oral contraceptive pills or an intrauterine device or a condom, whether it's a male condom or a female condom, when you have not used anything at all, this is called a unprotected sex. Can I have unprotected sex in safe period? No, definitely not. There is no 100% safe time in menstrual cycle where you can be 100% sure that you will not get pregnant. So please do not have unprotected sex at any time of the menstrual cycle. What is the risk of unprotected sex? Definitely the most important thing being unwanted pregnancy. But apart from unwanted pregnancy, there is a risk of sexually transmitted diseases or urinary tract infection, and of course the emotional stress of having to miss periods, or you may get pregnant, or even the whole stress of undergoing the treatment for this sexually transmitted diseases. Does douching after sex prevent pregnancy? Definitely not. Douching, any kind of douching, even douching with an antiseptic, will not help you to prevent pregnancy. Is withdrawal method safe as a contraceptive method? No, definitely not. Even when you practice withdrawal method, there is some amount of fluid that comes even before complete ejaculation, which may contain sperms. So please, this cannot be used as a safe method. So now you had an episode of unplanned or unprotected sex. So what do? First things first, you need to wash your private parts cleanly, consult your gynecologist. They will prescribe you an emergency contraceptive pill, and you have to do this at the earliest possible hour, because the emergency contraceptive works most effective in the first 24 hours of sexual activity. Of course, it can be used up to 5 days, but it is most effective within 24 hours of sexual activity. So how do you use the eye pill? It has to be taken at the earliest possible time, but it has to be taken with a full stomach and never with an empty stomach. And if you happen to vomit within 30 minutes of taking the tablet, then the effect of that tablet gets nullified, and you probably need to take one more tablet for complete effectiveness. The eye pill protects all sexual acts done before taking the tablet. So if there is an act of sexual activity after taking eye pill, it does not protect you from unwanted pregnancies. What are the other choices other than emergency contraception? Other than emergency contraception, you can go for a copper T insertion within 5 days of unprotected sex. Is it safe to have sex, say, on the 7th or 8th day of the menstrual period, which is supposed to be a safe day? So definitely not, because the sperms deposited in the vagina live for 72 hours. So never take this risk of unprotected sex at any point of the menstrual cycle. How would you know if you're pregnant? If you miss your periods, then the very next day you must do a urine pregnancy test with an early morning sample of urine, and also do a beta HCG test, which is a blood test which will tell you whether you are pregnant or not. So what are the symptoms of urinary tract infection or sexually transmitted diseases when you had an unprotected sex? So the signs of urinary tract infections are burning pain while passing urine, increased frequency of urination, lower abdomen pain, foul smelling urine, blood stained urine, backache, generalized weakness. And the symptoms of vaginal infections are white discharge, which could be yellowish, whitish or curdy, itching in the vagina, foul smelling white discharge, and lower abdomen pain, and generalized weakness. So if you have any of these symptoms with regard to urinary tract or vaginal infection, please consult your gynecologist immediately. What should be the treatment for sexually transmitted diseases in unprotected sex? So when people have sexually transmitted diseases, of course, you should visit your gynecologist, and depending on the examination, your symptoms and the test, they will prescribe you appropriate antibiotics. But the most important thing is both partners need to take medication for complete cure of infection so that it does not recur. How often can I use the I-pill? As the name suggests, I-pill is a emergency contraceptive pill. The word emergency itself tells us that you can use this only as a matter of emergency, and it cannot be used as a regular means of contraception. So what happens after you use the I-pill? Once you use the I-pill, there will be withdrawal bleeding probably in 3 to 7 days time, and now that becomes your new periods. It is also possible that the next 1 or 2 periods following the I-pill may go little haywire, but it does get regular eventually, and the withdrawal bleeding which happens after taking the I-pill, it becomes your time for the regular cycle, and then the regular cycle continues. Last but not the least, never go for unprotected sex, because there is a very high risk for dreaded infections as in HIV, HCV, HBsAg, and these diseases are not curable. So always practice safe sex. Thank you.